One of the mothers once came to the clinic looking very worried. She said, "Nurse, I don't understand what is happening. Since I became pregnant, I keep spitting every few seconds. I even sleep with a bowl beside my bed because I cannot keep swallowing the saliva. Is my baby alright? Is he or she okay?" Now, has anyone experienced something similar? You can always please drop it to the comment section and how you were able to rectify it. We are learning from one another. So the topic of today is, why do pregnant women spit so much? What causes it? The treatment and home remedies for excessive saliva in pregnancy. But before I continue, let me come up to introduce myself and also welcome you all. Good morning, my beautiful mothers. Welcome once again to our antenatal class, virtual antenatal class. My name is Nurse Destiny Omhenaka. I am a registered nurse, a registered midwife with over 15 years of experience, and the founder of Omhenaka Nursing and Maternity Home. Let me ask you a question. How many of you have been spitting almost every minute since you became pregnant? Some women carry a small container everywhere because they keep spitting. Some cannot even swallow their saliva. Some even think they have an infection or that something is seriously wrong. Today, we will answer these questions together. See, in my experiencing, some mothers immediately, they've taken in, immediately they become pregnant. They sometimes stay in the hospital throughout the 9 months pregnancy. You understand why some mothers, God just help them, after the first trimester, the excessive saliva is stopped. So spitting, excess saliva, as a pregnant woman is really not sickness. It's bound to happen. Okay, remember, every pregnancy is not the same. Why does this happen? Is it dangerous? Will it affect my baby? What can you do to reduce it? By the end of this class, you will understand why it happens and how to cope with it. So don't forget to hit the subscribe button, give this video a very big thumbs up, share to all pregnant women that you know, you understand, because you might just be saving a life. But to some extent, it's nature for a pregnant woman to spit, but it's not in all cases. Why do pregnant women spit so much? The medical name for this condition is Ptyalism Gravidarum. You don't worry about the big medical name. It simply means producing too much saliva during pregnancy. So normally, every person produces saliva to help digest food, keep the mouth moist, protect the teeth, and they fight germs. But during pregnancy, some women begin producing much more saliva than usual. Okay, now the next question is, what causes excessive spitting during pregnancy? There isn't one single cause. Several things may contribute. One, pregnancy hormones. Trust. You trust these hormones. You understand? They will not rest. You understand? When you become pregnant, hormones rise rapidly. These hormones affect almost every part of your body. They can also affect the glands that produces saliva. This is why excessive saliva is more common during the first trimester. Then the number 2 cause is morning sickness. This is one of the biggest reasons. Many women with severe nausea feel swallowing saliva makes them want to vomit. So instead of swallowing it, they keep spitting it out. This makes it seem like the baby is producing much more saliva. But in reality, part of the problem is that swallowing becomes difficult because of nausea. The number 3 causes is constant nausea. When you always feel sick, your body may naturally produce more saliva. So doctors, nurses, midwives believe this may be the body's way of protecting the mouth and the throat from stomach acid if vomiting occurs. The number 4 causes is acid reflux, that is heartburn. Most of the pregnant mothers, they experience this heartburn at night. You understand? So if you have ulcer or you experience this, always get antacid closer to you. Stomach acid comes up toward the throat. The body may produce extra saliva, to help neutralize the acid. The number 5 causes of excessive spitting is increased sensitivity. During pregnancy, your sense of smell and taste becomes stronger. Certain smells of foods can trigger nausea and increase saliva production. So the next question is excessive spitting dangerous? The good news is that it's usually not dangerous. It does not mean your baby is sick. It does not even mean that your pregnancy is abnormal. No, it's simply one of the many changes pregnancy hormones can cause. But however, if the excessive spitting is so severe, the extent that you cannot eat, you can't drink, or keep fluids down, you should come to the hospital. You may become dehydrated, especially if you are also vomiting frequently. Then when does it start? This pregnancy spitting all over, when exactly does it start? For many women, it begins between 6 and 8 weeks of pregnancy. It often becomes worse during the first trimester. Then for most mothers, it's gradually improved after about 12 to 16 weeks, although some continue to experience it throughout pregnancy. So every pregnancy is different. Okay, now the next one is, can it harm my baby? Can this spit excessive saliva? Can it harm my baby? No, of course. Excessive saliva itself does not harm your baby. The baby continues growing normally. The concern is only if severe nausea and vomiting prevent you from eating or drinking enough. That is why regular antenatal care is very, very important. So, the another big one is, what can you do to reduce excessive spitting? Now let's talk about practical tips. Drink small amounts of water frequently. Instead of drinking a large amount at once, take small sips throughout the day. This helps keep your mouth comfortable. Then another thing you can do is to brush your teeth regularly. Good oral hygiene can reduce the unpleasant taste in your mouth. Brush at least twice daily. Then the number 3 thing, which is the one I like going for, or the one that is, in fact, whenever I'm pregnant, that is what I do. Chew sugar-free gum. Chewing gum may encourage you to swallow saliva naturally. So some women find this very, very helpful. Then the next one is suck on lemon or citrus flavored sweets. Some mothers feel better sucking on lemon flavored sugar-free sweets. Then the next one is eat small meals. Do not stay hungry for long. Small frequent meals can reduce nausea. And another one is rest well. Fatigue can make pregnancy symptoms worse. Adequate rest may help reduce nausea. Then the next one is keep a tissue or small container. There is nothing to be ashamed of. Many pregnant women need one for a few weeks or months. Remember, these symptoms usually improve with time. Then the next one is, what should you avoid? What are those meals or those things that you need to stop? Do not stop drinking water because you think it increases saliva. You need enough fluid for yourself and your baby. Do not buy herbal medicine without speaking to your healthcare provider. Some herbs are unsafe during pregnancy. Now, the next one is, when should you come to the hospital? Please seek medical attention. If you cannot keep food down, you cannot drink water, you cannot even take anything, you become very weak. You notice signs of dehydration such as dizziness or passing very little urine, you are vomiting continuously, and you lose significant weight. These symptoms may require treatment immediately. So mothers, excessive spitting during pregnancy can be frustrating, but in most cases it's a normal pregnancy symptoms. It's usually caused by pregnancy hormones, morning sickness, nausea, or acid reflux. It does not harm your baby. The condition often improves as pregnancy progresses. Please continue attending your antenatal clinic, eat healthy food, stay hydrated, and then always tell your midwife or doctor if your symptoms become severe. Okay, now is the quiz. Oh my god. Okay, the question is, I am me now asking you questions. You now answering it in the comment section. So what are the questions? Before we enter this class, I want to ask you, who can tell me one cause of excessive spitting during pregnancy? It's simple, right? Okay, the number 2 question is, can someone mention one thing you can do at home to reduce it? All right, this is where we draw the curtain, to the wonderful esteemed mothers all around the world. Remember, no concern is too small to discuss during antenatal care. We are here to support you throughout your pregnancy. So if you found this lesson helpful, please share it with another pregnant woman who may be experiencing excessive spitting. But just in case you have not subscribed to this channel, why not hit the subscribe button, forgetting that subscription is free. Then share it to every mothers around you so that they too can benefit from it, knowing the reasons why they spit, especially the one that carry container. It will be good for them to know why they do it. You understand? That is the reason why You should share it to mothers all around you. If there are mothers in any group, you can actually share the link to them so that they too can watch the video and they know why things are like this, know why they are always carry containers or buckets or tissue to spit on it during their pregnancy. So one gets to another, one gets to another. The Bible says, it says, my people are perished because of lack of knowledge. So knowledge has come. It is time. Kindly share it to everyone. And then also on your notification bell so that anytime we set a post like this, you'll be the first person to get it. Please watch out for another beneficial, educative, and stay informed. Bye.